Uh, Good afternoon for those of us on the East Coast, still good morning for those on the West. Welcome to our UMD-PRC webinar series. We are so excited to have Dr. Meg Paceley here today to talk with us about engaging communities and systems to support health equity for transgender and gender diverse youth. Please, if you can, let us in the chat, let us know who you are and where you're signing in from. We'd love to see who's here with us. And I want us to start with a few quick reminders. The first is that this will be recorded. It is recorded, so please be aware of that. Please do submit your questions in the Q&A feature for us as we go throughout the presentation. We'll be able to answer those questions at the end of the presentation. And of course, closed captioning is available through Zoom's automatic live captioning feature that you can activate in your settings if you wish to do so. And before we get started, I just want to do a brief introduction of our speaker today. Dr. Meg Paceley is an associate professor at the University of Kansas School of Social Welfare. Their research explores the relationship between queer and trans youth families, schools, and communities, and their health and well-being. They aim to transform these contexts and systems to reduce negative health outcomes and promote resilience and well-being for queer and trans young people. I can say that Dr. Paceley's work has been incredibly influential on my own in terms of my thinking, the research that I do with communities, and I'm just so excited to have you here today. So thanks for joining us, and I'll turn it over to you.
Thank you, Dr. Fish, and thank you all for being here. I'm excited, and yeah, welcome. I want to start with an introduction. I have too many screens open in front of me. Okay, I want to start with an introduction a bit beyond what Dr. Fish shared. First of all, thank you, Dr. Fish, for introducing me. I think it's helpful to provide a bit more context for who I am and how I situate the work that we're going to talk about today. I have some images that I'm going to show, and I'll provide like a verbal image description for accessibility for anyone who might need those. So I'm going to start here. This is a picture of me very, very long ago, wearing a white dress, holding a baby doll. I was probably just a couple months old here. I grew up in the 80s and 90s in the Midwest of the US in a small factory town surrounded by cornfields. Not a rural community, but a small town nonetheless. I'm the oldest of two. My parents are divorced, both remarried, and still only live about a mile from each other. This here is one of my favorite pictures of me and my dad. It's me, maybe around 5 years old, wearing jeans and a blue shirt. I'm hanging out in the back of a red truck with my dad, who's standing on the outside of the truck. I love this picture because it embodies him and our relationship. And of course, I'm in the back of a red truck, which was a common occurrence in my childhood. My dad is a mechanic who recently retired after owning his own business for almost 3 decades. This next picture is me as a toddler, grinning widely and sitting on my mom's lap. We're both on a very 80s style brown couch. My mom is a retired psychologist who worked in gender-based violence prevention for people with disabilities. Finally, on this slide, there's a picture of me on career day in 6th grade. I thought I might be a journalist because I love to write, although I'm not sure why I thought this outfit embodied journalist. It feels much more Madonna-esque with the jean skirt and the pearls and the large bow in my hair. And I like to show this because I did become a writer, although not in the journalist sense. So fast forward many years, I've lived in Kansas for almost 7 years, and I'm an associate professor at the University of Kansas School of Social Welfare. Here you can see a picture of the Jayhawk mascot, which is a very loved and revered image here in Kansas. So between growing up near the cornfields and getting tenure, I also flunked out of college on my first attempt. I moved to North Carolina and back to Illinois. I came out as queer. I got my MSW. I got married. I had a PhD, got my PhD. I had a baby, ended a long-term relationship, and more recently came out as genderqueer as well as cisgender, among other things. So here you see a picture of the inclusive pride flag. This includes the 6 colors of the pride flag, as well as the colors of the trans pride flag, as well as black and brown, to symbolize the important work that the black and brown, queer and trans people have done for equity and equality. Finally, this last picture is a picture of my kiddo walking along a rocky trail holding a pink umbrella. And I share this because it reminds me that this work is a process, and sometimes the process is as important as the destination. So why do I tell you all this, especially in a professional setting? I often start with my positionality as a white, queer, genderqueer, cisgender woman with economic, educational, and professional privilege. But why these other details? I share because I think they're relevant to my personal and professional position, to my research, to my decision to even become a social worker. And they're the kinds of things that all of us bring to our research or our work with really with anyone, but specifically for this presentation with LGBTQ and specifically transgender and gender diverse individuals and communities. And we bring this even when we think we won't or we think that we shouldn't. So for example, my queerness directly intersects with my professional identity as a social work scholar and a professor. I came out as queer to myself and others shortly before beginning my MSW program. I dug into the research and practice knowledge at that time on working with LGBTQ clients, and I was disturbed at the lack of knowledge in that area. That led me to get my PhD. Having a PhD, of course, intersects with many areas of privilege in my life, including my race and my class. Another example is the town that I lived in when I came out was in no way rural, but it lacked supports that urban communities often have. This informed my passion for understanding and improving communities. Finally, I'm a middle-aged adult doing research with queer and trans youth. I was never out as an adolescent, and even if I had been, the context changes a lot in 25 years. I don't know what it's like to be trans, and I certainly don't know what it's like to be a young person in 2022. So that's an introduction to me and what I bring to this work and the presentation today. So having that context, let's jump into the presentation. I'm going to start with some background on transgender and gender diverse, or TGD youth, specifically around risk and resilience. And then I want to highlight how risk and resilience show up in various social contexts. I'm going to spend the bulk of the presentation discussing how we can transform these contexts to promote health equity for TGD youth. And in this section, I'm going to provide you with some quotes from trans and gender diverse young people to really emphasize the voices and expertise of trans people and youth across several different research studies. So let's start with identifying TGD youth risks. So the research is pretty clear. We know that trans young people experience higher rates of depression, suicidal ideation and attempts, substance use, stress, eating disorders, among other mental and behavioral health concerns. But importantly, these aren't inherently a part of being trans or gender diverse. Instead, they're related to these experiences that happen in trans and gender diverse youth context. So things like victimization, stigma, harassment, violence within family of origin, running away from home because of violence, being kicked out of the home, and then subsequently homelessness. And we have research that shows that these anti-trans experiences are related to these increased rates of mental and behavioral health concerns. We also have research that demonstrates that trans youth are resilient and that they demonstrate this capacity for resilience through a number of different factors. So I'm just going to kind of highlight these. Some of them will show up a little bit later in the presentation. Excuse me. So things like creating community. So we see that trans youth, one of the ways that they navigate oppressive systems and environments is by finding ways to create community with other trans and queer people. We also see resisting oppressive narratives. So this might be a trans young person saying, I know that you think trans people are X, and that's not me, and I'm gonna push back against that narrative and be who I am. This kind of relates to one on the other side of self-definition and authenticity. There's some really cool work that's happening with some scholars that are looking at the way that trans young people are defining their gender and maybe how that shifts over time and their ability to be authentic within their own gender and gender identities and expressions. We also see visibility and representation as related to resilience. So the more trans young people are seeing trans people in their communities or in the media, particularly displayed in positive and non-oppressive ways, they're also demonstrating resilience in that way. Similarly, we see trans youth engaged in activism and advocacy to fight against oppressive systems and work towards creating more equitable systems and environments for themselves as well as other trans people. We'll talk about families a little bit later, but we also see one way that trans youth are navigating oppression and demonstrating resilience is through navigating challenging relationships. So, you know, they often don't have a choice of the environment that they're living in or the school that they're going to. And so the ways that they are navigating parents who may not be as accepting as we would like, or teachers who refuse to use their name or pronoun, or friends who are maybe trying to be accepting, but just don't know how to do that. So the ways in which they're navigating those relationships. Similarly, we know that having supportive friends and family is associated with resilience for trans youth. And then finally, supportive policies and contexts. We'll talk more about this a little bit later because this absolutely comes up in the research. So what these past two slides show me is that context matters, that where youth are living, who they're living with, what those environments are like, are critical to their health and well-being. So I'm going to talk about three contexts here. We're going to talk about community, school, and family. So starting with community, we have some research that shows that region of the US matters. So for this data is specifically for queer and trans youth. For queer and trans youth living in the Midwest and the southern parts of the US, we see increased rates of anti-LGBTQ victimization compared to youth living in other parts of the country. We also know that the geographic context matters. So youth who live in, this is for queer and trans youth again, who live in rural communities have increased rates of suicidal ideation and drug use and lower access to supportive resources that they might be able to use to cope with like increased rates of victimization or suicidal ideation. And so these factors relate to community climate. And so when I say community climate, what I mean is the level of support for or hostility toward trans people in a community. And we have some research that shows that supportive communities, measured in a variety of different ways, a bit beyond the scope of what I'm talking about today, but that supportive communities are associated with lower rates of alcohol use, decreased engagement in sexual behavior that might be more risky, and increased access to supportive resources. Alternatively, we know that hostile communities are associated with increased rates of victimization, higher depression, higher anxiety, and that LGBTQ youth who live in hostile communities are 20% more likely to attempt suicide. All right, moving into the school context. This data specifically comes from the GLSEN biannual survey of schools. And this is just a small amount of their data that they have. But we know that trans youth specifically experience safety issues in school. So over 50% report feeling unsafe in the school environment, and 60% reported discrimination. This was in 2019. And that these anti-LGBTQ victimization is associated with things like lower GPA, lower self-esteem, and decreased sense of belonging at school. And that they're also associated with higher truancy and higher levels of depression. So finally, thinking about the family context, we have a pretty wealth of research that talks about family rejection versus family acceptance. And this is specifically related to gender and sexuality. So family rejection is associated with youth being 8 times more likely to attempt suicide compared to youth who are in families that are accepting, 6 times more likely to report high levels of depression, and 3 times more likely to engage in substance use. Alternatively, LGBTQ youth in families that are accepting report higher life satisfaction and fewer depressive symptoms. Something that I think is really important that the research is supporting is that often families are not all rejecting or all accepting. So really situating families as a binary of are they accepting or are they rejecting isn't always all that useful. It's better to think of accepting behaviors and rejecting behaviors as potentially co-occurring within families. So for example, there's a study that was conducted with trans and gender diverse adults that showed that the most common experience in families is one of both acceptance and rejection, and that this sort of ambiguity or uncertainty within the family environment can actually be more harmful than outright rejection. You can imagine a trans young person growing up and not knowing one day to the next how the family might react, or what type of response they're going to get to asking for gender affirming healthcare or bringing a partner home or something along those lines. We also have some research that demonstrates that trans and gender diverse youth often have to balance this need for family acceptance, which is hugely important for their health and well-being, with also staying connected to their family. And for some youth, staying connected to their family isn't an option. It's too harmful, it's too painful. And for some, they have to figure out how to balance that need, whether it's a physical safety need, an emotional need to stay physically connected to a family, and also the need for family acceptance. So this leads me to ask, and really the focus of today's presentation is, how do we intervene then to shift these oppressive and stigmatizing contexts and systems to be more just, to promote health equity for trans and gender diverse young people? I'm going to share sort of a mix of findings and some quotes from youth from 4 different studies. This is the only slide I'm going to talk about the study specifically, because I really want to focus on potential interventions and areas to shift systems and context. But I did want to provide you with a brief overview of this is where the data and the findings are coming from. So the studies vary from starting in 2014 to as most recent as last year. They all include qualitative interviews or focus groups with young people. You can see that one includes surveys. The last 3 were specific to trans young people. Okay, so I'm going to talk about 4 broad areas to shift systems and context to promote health equity. So in this section, I'm going to start with resources. I'm going to provide you with an overview, and then I'm going to share 2 quotes from trans young people, and then talk about 3 to 4 interventions that I think we can apply within each of these. One moment. Okay, so first, this research shows that trans and gender diverse youth need access to trans affirming resources in their schools and communities. So this might seem obvious, of course they do, but youth in these studies repeatedly discussed a need for resources that were specifically for trans youth. So this was important even if a broader LGBTQ organization or group existed. Even those groups needed to be trans specific or explicitly trans affirming. Resources includes trans groups, programs, and events in the community or the school, but also access to healthcare that's trans affirming. So this could be resources for gender affirming care, such as hormone blockers or gender affirming therapy, but also pediatricians and other doctors who are just affirming of the young person's gender in their care. So the first quote is from Peter, who is, at the time of the interview, was 17, identified as non-binary and Indigenous and Latinx. And when they were discussing TGD-specific organizations, they said, "It's really good. I've got to meet a lot of kids that I relate to, and it's nice to see that I'm not alone. Even though my city is such a big place, and you feel like not everyone has your same views, sometimes just being around people that you love and you know share a similar identity to you can make you feel so great about being yourself. Even if it's just driving around town at midnight, screeching Shakira down the highway, it just feels really good. It feels like you're at home." Another quote from Tyra, who was 22 at the time of the interview, trans woman and Black, said, talked about the intersections of being trans and Black, particularly in spaces that were broader than that. So she said, transness and queer spaces are interesting intersections. They're not separate, but they're not always equal in the spaces that are provided or for the voices of the identities being affected to speak. I do have a community where I live now, but it's not as much as a community as I would like. I know 1 or 2 other Black trans folks in this town. So when we think about what can we do as scholars, community, people working in the community, social workers, educators, I think there's 4 things that we can do to work towards promoting TGD resources, particularly within schools or communities. First, we have to identify ways to promote new resources. So obviously this could be complex. In small towns or rural communities, there may not be resources or community support to provide a large visible resource. But I would argue that it doesn't have to be something really big like that in order to provide support for trans youth. A monthly group meeting at a local affirming church, a gender and sexuality alliance at a high school, or an informal sort of social group of queer and trans adolescents can all be affirming resources, even in communities where something bigger isn't possible. Second, we can increase accessibility to resources that are already in the community that are trans affirming. So you can ask questions like, what is in my community? Does this already exist? If so, how can I support that group? Can I make referrals to it? Can I use the skills that I have to help them build up their programming? How can I help increase accessibility, right? Is transportation an issue for youth to get to that organization? Third, and I'm going to talk about this, I think this shows up in almost all of the next few slides, but a key thing to consider in resource development and promotion is balancing of visibility of the resource with safety of those attending. And there's really not an easy answer for this. So resources and organizations have got to be visible in order to signify support, both at a broad community level and also just so youth know that the resource even exists. However, visibility can also render these resources unsafe if unsupportive community members protest or even threaten people using the resource. It may be that young people are afraid to use a resource that's highly visible because they don't want to be outed, or that's a concern that they have. So in my experience, it's really about balancing and holding space for both visibility and safety to coexist, and talking with youth directly about what they feel comfortable with. We'll talk about visibility again in a little while. Finally, as social workers, clinicians, educators, whatever our role is in supporting trans young people, we can work to influence local medical and mental health providers on trans affirming care, or we can partner with people who have that skill set and are able to do that. So this might include sharing the basics for creating affirming practices. So helping folks create intake forms with multiple gender options, having a space where young people or clients can share pronouns or a name other than a legal name, things like that. It also means training staff and providers on effective strategies and practices for working with trans youth. Okay, the next strategy is to increase visibility of trans people, as well as visibility of support for trans people. Visibility is a critical component to helping trans youth. Again, you're going to hear me say it in almost every intervention that I talk about. And in some ways, particularly when I've talked with trans youth, this idea of visibility can be an act of like queering or resistance all on its own. Just being visible in a society that says you shouldn't exist is really powerful. And this is particularly powerful in a society that ascribes to this binary gender system and really punishes those who veer away from that system. So first quote in this section is from Carter, 17, identified as transmasculine and Latinx. And he said, When other people or I had a problem with another student about how I identified, he stood up. He was referencing a student in his class. He stood up immediately and he was like, he can do whatever he wants. Why does it have anything to do with you? So I think that's a situation I really enjoy looking back on. And Carter talked at length about the visibility of support that students showed him in the school environment. Next is Blake. Blake was 19, transmasculine and white, and was discussing the election of trans people to government in a recent election that had happened in his community. And he said, times are changing. Maybe I'll be able to do something like that someday. It makes me hopeful. And so you can see the sort of visibility of trans people in government, for example, was something that provided Blake with a sense of hope. So, as I've already mentioned, we can see that visibility is important, but it's not always safe or possible for trans people to be out and visible for a number of reasons. So the implication of this for me is complicated. The visibility of trans people is important to the well-being of trans youth, and it works to improve the local community climate, but it also puts the onus to fix a community that might be transphobic or anti-trans on trans adults who also experience marginalization and stigma, which isn't fair or isn't something that we should necessarily expect. So I think there's a few things that we can do beyond sort of putting the onus on trans people and adults to come out or be visible. First, we have to increase our individual support for trans people and trans communities and make that support visible, especially if we are cisgender. So increasing visibility of support can do multiple things. It can signal to trans youth that there are supportive people locally. It can increase safety for trans adults who may wish to be more visible. And it can result in a shift to community climate, moving more towards support because we're working as a community to challenge these oppressive attitudes and ideas. We can also do this on a more macro level, adding signs of support, such as rainbow and trans flags at our homes, our organizations, and offices. Can't tell you how many youth told me that just seeing a rainbow sticker in a business window as they walked around downtown was like, it was an amazing feeling. I can't fully describe the joy that they felt at seeing something like that. And then finally, we have to work to address safety issues in our community. Some of that will be through policy, which I'll talk about next, but really education and being visible in our support for trans people and equity. Okay, so I'm going to move on to policies. According to trans youth in multiple studies that I've talked with, policies that are anti-trans, such as really like the notorious bathroom bills that seek to limit bathroom usage to somebody's sex assigned at birth, they send a message to trans youth that they're not welcome, that something is wrong with them. And we see this happening. We saw this happen last year. We see it happening again this year with proposed policies to ban trans youth from sports and to limit access to healthcare across the United States. It also sets trans youth up to be physically unsafe in these spaces. Alternatively, policies that are pro-trans or supportive of trans people, such as a school policy that mandates a young person's personal name and pronoun use, regardless of what's on their birth certificate. These types of policies send messages of affirmation and validation to youth. It also requires others to act in a way that minimizes stigma. So for example, if an educator, a teacher is required to use a trans person's personal name and pronoun, whatever it is that they want, this can reduce the stigma, even if the instructor would normally choose not to. Let's go to the quotes. All right, so Cassidy, who was 20, a trans woman and white, talked about a teacher who, and this was in an undergraduate class in college, who refused to use her name because there was no policy that mandated he do so. And so he said, on the system, it says, this is your name, and this is what I have to go by, and that is what I prefer. So there was no policy set up to protect her in that situation. Alex, who is 19, transmasculine and non-binary and white, also talked about a similar situation with a teacher who refused to use their name because there was no policy. They said, that's all everybody would talk about. Sorry, this was a different example. I forgot to change the label. This was about the rhetoric that was happening in class around policies that were anti-trans. And they said, my teachers would talk about it. It's all everybody would talk about. Everyone was debating whether or not trans people were dangerous, just kind of like a weird sexual being that shouldn't be allowed to be in public spaces with other people. It was a huge debate about pretty much whether trans people should be allowed to exist in public or not. This was a specific example where there was a bathroom bill being proposed in a nearby community, and Alex's teacher in high school had set up a debate in the class where the students were required to debate one side or the other of this issue. So when we think about some strategies for addressing policy issues in this area, first we have to get an idea of the landscape, right? What are the policies in our organizations, in the schools in our community, at our community or county level in our state? Are they affirming of trans youth? Are they neutral in that trans youth aren't even named in them at all? Or are they explicitly hostile and anti-trans? We sort of have to know what we're dealing with in order to begin to intervene. Second, we can advocate for explicitly supportive policies as well as their enforcement. So this might include a policy at a social work agency where clients are asked the name they want their provider to use, or mandating gender inclusive bathroom spaces within the policy at an organization. It can also be statewide or county non-discrimination policies that include gender identity as a protected class. And then finally, as we saw with what happened with Alex, in any space we're in, it's essential that we're monitoring the rhetoric around policies and other trans-related issues and discussion around it, even if it's not a formal debate like what was set up in Alex's classroom. Just hearing other people talk about and debating one's humanity can be really damaging. So if there's a debate that's happening, are we stepping in, right? Are we making our support for trans people visible? Are we stopping these public debates around trans people's humanity? And then finally, the last strategy I want to talk about is to promote acceptance of diverse genders and specifically trans youth. So this might seem obvious, but trans youth shared specific things they perceived as necessary in their communities to move things towards acceptance. A couple quotes. Elijah, who's 19, trans man and white, said, he had talked about moving from one city to another. He said, before I came here, I heard that the city is a really liberal town. But now that I'm here, I'm kind of getting mixed signals. Walking on Main Street, I wore my Protect Trans Kids shirt. I got a lot of thumbs up from people, and I love your shirt. Then I also got a lot of weird stares and people frowning at me. Similarly, Elliot, who's 17, transmasculine, non-binary, and white, said, I hear people saying at school all the time that's just making jokes about something that they probably don't fully understand, turning it into a caricature. Some boys in my history class, they'll be joking around about people identifying as things that aren't male or female. They'll be like, so you identify as a toaster and stuff like that. So Elijah and Elliot both talked about, Elijah more so about the mix of acceptance and rejection, and Elliot specifically around the lack of acceptance in terms of how students in their class were making jokes. So how do we promote acceptance in our communities? This is maybe the big question, right? One of the most important things we can do is talk to other people, especially as cisgender allies and accomplices. We have to educate our colleagues, our family members, our kids' teachers, local government, religious leaders, and so on. Anybody that that might need it, that we come in contact with. I regularly have to remind myself that people rarely change after one conversation, and that it's worth it. That I carry a lot of privilege and power in my role, both with my identities as well as in my professional position, and that it's worth it to have these really hard conversations for the sake of trans youth and trans people in my community. To keep having these conversations, even when they're hard, even when they're frustrating. Another thing you can do is if you have expertise or knowledge in the area, offer trainings or workshops for your organization or your community. Visibility, again, being visible in our acceptance as much as possible in any way that we can. And I think across the board with all of this, working with trans youth and adults to ensure that our work is meeting their needs. I like to end with this quote from the Trevor Project that was reporting on research that shows that LGBTQ youth who report having at least one accepting adult in their life were also 40% less likely to report a suicide attempt in the past year. And that's just one adult. This has stuck with me ever since I read it, because I think it's such a small thing we can do to be accepting, right? And to be visible of our acceptance in the lives of, for this presentation specifically, trans youth. And yet it has such a huge impact. If I think about how much more of an impact could we have if we're going even above and beyond just being a supportive person. So I'm going to end with that as sort of a call to action for all of us to think about what we can do. I wanted to save plenty of time for Q&A and discussion. So I'm going to leave this slide up for just a moment so that you all have my email, although I can put it in the chat. And then I will stop sharing my screen so that I can engage with you all in the questions that you have. Thank you for being here today.
Thank you, Dr. Paceley, for that presentation. It does look like we have a great mix of folks in the audience in terms of where you're coming from all over the US, but also in the roles that you hold in LGBTQ centers, campus-based supports, academic institutions. And so I really do want to encourage folks to please drop some questions or comments, thoughts, their own kind of experience working with trans youth in the chat. We do have a question, it looks like. Do you want me to read these to you, Dr. Paceley, or do you want to look at these yourself? What would be easiest?
If you don't mind reading them, that would be great.
Yeah, happy to. So this first one is, does the research on family acceptance and / rejection look at the differences for transgender and gender diverse folks when the ambiguity of behaviors are from individual people, or say having one accepting parent and one rejecting parent?
That is a really great question, and I don't know the answer to it fully. From what I've read about the ambiguity, it's been more specific to the family at large, as opposed to one individual versus another. So I don't know the answer for sure. I would suspect that having somebody who's fully accepting would do a lot towards supporting a young person and promoting their health and well-being. But I'm telling you that based on my assumption, based on what I've read, and I don't know that there's a study that's looked at this specifically, or if it has, I haven't found it. It's a great question.
Yeah. Do you mind if I actually chime up? We have a student in our program who actually has a paper under review right now that looks at this ambiguity piece, Sam Allen, and the work that they've done is finding that ambiguity is actually more harmful than outright rejection. In his kind of hypothesis is that the inability to know what to expect with any given person or within a family context it seems to be more harmful to mental health than outright rejection, which is kind of knowing where you stand at least.
Yeah, absolutely.
Yeah. Another question. How do you think the pandemic has affected access to resources for trans youth? Just wondering when my youth group switched online, we got a bunch of new kids who live in rural communities, but also lost many of the kids that had been in their in-person group.
Yeah, that's another great question. Dr. Fish and I have done a little bit of work together in this area, especially more early pandemic than 2 years in now. And I think exactly what you're saying is that in some ways it's increased accessibility of programming for youth who might not have otherwise had access given the online format. And it's also produced challenges, right? So we have trans youth who may not be out at home, or who may be in homes that are ambiguous or in terms of their support, or that are rejecting. And so having an online support group, or an online, even a social event, they're not going to be able to sit there on Zoom or whatever the resource is and talk about being trans, because it's not safe in their home environment to do so. I've also talked with trans youth who said, even text-based, their parents are checking their phone. And so it has created some additional barriers for trans folks as well. And I don't know what the answer is, right? Like in some ways it's increasing accessibility. It is increasing accessibility for some folks, and it's safer physically during a pandemic. And for some youth, it's increasing their risk because they just don't have the ability to participate in that. So, yeah.
Absolutely. A comment in the chat, as a trans youth, sometimes I walk by businesses with flags or stickers in their window, which I agree is nice. However, do you think symbols of performative activism without real action, for example, just putting up the flag in the window but still being homophobic or transphobic organization, cause more harm than good? I guess would tie to the ambiguity of rejection acceptance that you talked about.
Yeah, absolutely. That's such y'all have great questions. I think when I talked with the youth, what they would say is like that they felt seen, right? That having a sticker in a window sent a message of support. And of course, if that support is not followed up with action, or if they go into that store and they're treated poorly, or they're treated as if, they're told they can't use a certain restroom or changing room, or they're misgendered or whatever it might be, that sticker in the window doesn't matter. And like you said, it does absolutely do more harm than good. So 100%, the sticker is nice. It does send a message and it's important, and it 100% is not enough. It has to be followed through with these other actions to support trans folks.
Again, please keep putting your thoughts, comments, questions in the chat or in the Q&A. I know that recently you had published a piece where you had talked with some trans and gender diverse youth and young adults in Kansas about some of the anti-trans legislation that's been going on in states, particularly in Kansas as well. And I'm wondering if you could talk about your conversation with those young people and kind of anything that you've gleaned, actionable things that you've gleaned from those conversations that we could be thinking about as we in our own states are potentially dealing with some of these anti-trans legislative efforts to ban trans youth in sports, for example, or access to life-saving medical care and things like that.
Yeah, absolutely. So this study was from last summer, early summer. So it was pretty much in direct response to the early 2021 sort of wave, right, of anti-trans legislation that was being proposed across the US, specifically really in a couple of areas around the sports bills and banning trans girls from participating in girls' sports, and then the bans on gender-affirming healthcare for trans folks under the age of 18. And I was talking with somebody who did some work with the legislature, not serving as a legislator, but trying to move policy in a more supportive direction. And she was telling me that there were legislators there was lobbyists, folks coming in and saying, this is harmful. The research shows that even just proposing these policies is going to increase suicidality and suicide risk for trans folks. And the response was that they were being dramatic, that this was not something that was actually going to happen, anyway. And so she called on me, and I reached out to Dr. Fish and some others, and we said, we know what the research says, but we can also do this sort of like rapid research project to show that this is also happening in real time. And so did a focus group with trans youth in one specific state. I don't remember if we named the state, but and just asked them, like, what do you know about these policies that are being proposed in your state or in other states? What are your reactions to it? How are you feeling about it? What needs to happen? What needs to change? And of course, their sentiments echoed what we already know in the research, that having people debate their humanity, having people say that they don't deserve access to gender affirming care, which for most of them is like a doctor who affirms that it's okay to be trans, who says like, what name do you want to use? What pronoun do you want to use? And it's not like surgeries, right? For most of them, how harmful that is, even if the policy never passes. which here in Kansas, it didn't. And that doesn't mean that the debate that was going around them at the state level was any less impactful to the young people. And it only barely didn't pass. So that also sends a message, right? And so you asked sort of what was their perspective about what we should be doing about that. They were talking about being engaged in activism and advocacy and almost feeling like they had to, that it was like their lives, right? Their lives are at stake. And so I think any burden we can take off as adults, regardless of our gender identity, but particularly as folks who have privilege with our gender and our gender identity, to stand up and say, like, this isn't okay, to present the research, to find ways to counter and negate the negative messages youth are hearing with supportive ones of, like, you are valid, these laws are not okay, you deserve to have gender affirming healthcare, you deserve to play sports if that's what you want, those kinds of things.
Absolutely. I think just reiterating the point that just the discussion of the proposed legislation is harmful, whether or not it's passed, and being passed is a whole nother boat of issues. Some other questions in the chat. Hi, I'm a mother of a trans man and a diversity educator with a specific interest in improving LGBTQ+ health and addressing health disparities. I agree with you that community is a really important factor for the overall well-being of trans and gender diverse youth, but what about those who prefer to be stealth? How do you think we can best support them and encourage them to find their community while also protecting their privacy?
Yeah, that's a good question. And I think this is what part of what I was trying to get at with, like, we can't put the onus on trans people and specifically, well, regardless of age, right, to come out and to be visible in order to change things, right? We should be changing things because trans people deserve to be safe and valid and respected, and trans people get to decide for themselves, right, what that looks like in their life, whether it's being out and open and visible or whether it's not. And for folks who choose not to be visible in their trans identity, community might look different for them, right? That they may not desire or want a connection specifically to the LGBTQ or trans community. If they do, I think that's a different situation. And how can we make sure that we're providing access? And I say we as in, like, service providers or educators, providing access to spaces where people can find that community and also have their identities be confidential if they want that to be, or anonymous in some spaces. So I think it's, again, about balancing safety and visibility for folks who need that.
Yeah, absolutely. Another question, we in Texas are thinking lots about parents' roles in trans advocacy. Here, in many ways, parents of trans youth are doing lots of the heavy lifting and advocacy and are bearing the brunt of a lot of the hatred. Do you have any research or thoughts on how we can promote the resilience of parents of trans youth? Great question.
That is a great question. I don't have that specific research, although it's super important. I would look towards authors and scholars like Kate Kubelanka, who are doing a lot of research with parents, particularly of younger trans children. And you're absolutely right. I mean, we see, I've had conversations with parents and other folks who are navigating these exact things, and the fear of state involvement in their life, right? That there's been cases of kids who have been removed from the home because the parents were allowing them to be who they are, right? Like affirming their gender. And so the need to advocate and change things so that your kid can be in a safe, supportive place at the same time. Again, it's that safety visibility, right? Of trying to ensure that also your kid gets to stay with you because that's the safest thing, or that there's not an issue with school. And so I'm not fully answering your question, but I think I would look towards Dr. Kubelanka's work, and then I'm sure that she's cited other folks specifically in this area.
Yeah,
there's Dr. Fish.
Yeah, Kate Kubelanka was the first person who came to mind for me as well. And I think it also, this points to a broader discussion too on how historically our kind of community service model in the LGBTQ space was first adults back in the 80s and 90s, and then to youth in the 90s and 2000s. And now we're really thinking about how do we expand services? And lots of LGBTQ community organizations have already integrated into these models of services. It's families, right? So these are parents who are right alongside their children, their youth, who are advocating and needing services and supports and resources. And it's a really kind of a new way of thinking about supporting LGBTQ plus youth in the context of family. In addition to LGBT youth who may or may not also have that support in place. So it's an interesting thing to start thinking about how this changes the way we're thinking about community-based models of service and care for LGBTQ populations.
Absolutely. And I think what I'm also hearing in this is that it's still the people that are the most affected who are doing the labor, right? The heavy lifting.
Yeah. Another question in the chat, what advice do you have for social workers wanting to get involved in this kind of research?
Yeah, I mean, I think it depends on what you're doing already, right? Are you in clinical practice? Are you doing community-based, more macro work? Are you connected to a university? That probably might be a key way. I think email me, also a social worker doing this kind of research. So like, let's talk. But also, I mean, you know, even if it's not something that we work on together, you know, I could connect you with other scholars in social work that are doing this kind of work and that may be more specific to what you're interested in. So I would start with kind of looking and seeing what other social workers are doing, looking at our professional organizations, you know, NASW, but also things like CSWE, which is the Council on Social Work Education. And again, email me and I can make more specific connections for you.
Great. Another question in the chat, have you seen any data on parenting style, for example, authoritarian versus permissive and so on, and its relation to acceptance versus rejection of their queer kids?
I have not seen anything specific to that. I'm wondering, not to put you on the spot, Dr. Fish, but if you've seen anything specific to that area.
I have not either. Yeah, that hasn't been a space of inquiry that I've noticed in literature.
Lots of good potential research questions coming up in this space, though.
Yes, discussions are great for that. Absolutely.
Yep.
Okay. Any other questions, thoughts, or comments coming up for folks? We have a few more minutes left. While we're waiting for folks to think about asking those questions, I'm also going to share, just because the conversation has been a little bit on this policy piece that's been going on in states across the country for the last 2 legislative sessions, a link to the Society for Research and Child Development's recent policy with what they call a policy brief called the Statement of the Evidence, which provides some level of scientific consensus around the importance of trans affirmative policies for the health and wellness of trans and gender diverse young people. So I share that with you all. Hopefully it's a useful tool as you're doing work in your communities to support families and young people. So feel free to check that out and download that, share it with policymakers and other advocates in your community. Great, another question popped in. I know you spoke of location or region and its importance for community impact. Have you seen the same trend related to political affiliation, red or blue states, if you will?
Yeah, that's a great question. Some of the earlier research on community climate looked at more on voting trends as opposed to like red versus blue states, although very similar. And so some of the work of like Dr. Ramona Oswald in this area, she developed a measure of community climate, and one of the factors that was included in that was voting trends within a county. So it wasn't at the state level, but within a county. So, and there was some, what's the word I'm looking for? There was some significance around whether a county was more voting Republican versus Democrat and or like Green Party at the time, with hostility being associated, more hostile communities being associated with voting more towards Republican or conservative candidates. And this was specific to presidential elections, not more like local based elections. So I've absolutely seen that. Again, I don't know that I've seen it at the state level, although that doesn't mean it doesn't exist. I just haven't seen it and I'm not recalling it.
Yeah, I know some of Mark Katzenbuehler's work with his kind of policy index. One of his typical indices is registered Republicans and Democrats as a a proxy for climate. So I think that's been used in a couple of different ways. Another question, I noticed a number of studies you cited were looking at queer and trans kids, not just trans kids. Do you have a sense of what direction the research is heading in terms of having more trans-specific youth research? Great question.
Yeah. It is a great question. I try to be specific in the studies that I'm citing to say like this one is trans-specific or this one includes both. And even the ones that includes both, sometimes they'll separate it out by gender or sexual orientation. I'm seeing a huge trend for at least being really explicit about who we're talking about, right? That if I do a qualitative study of 20 people and I say it's LGBTQ, but only 2 are really the T, right? Should I really be calling my study LGBTQ? So being really explicit in naming who it is that we included in our study, and also to really understand that there's similarities and different and consistencies, but there's also differences between sexuality and gender that warrant individual exploration, and that grouping them together sometimes is just doesn't provide the kind of data that would be useful, and it also sometimes even further marginalizes those who are experiencing more marginalization. So in this case, further marginalizing trans and gender diverse folks because their experiences are then lumped in with folks who have more privilege in that area. So I'm seeing a trend towards separating in terms of studies or being really explicit and doing, like with a quantitative study, doing subgroup analyses when we can to be more explicit.
Absolutely. I think that's definitely a direction that we're going in, that we need to go in, and understanding those unique experiences. I think I could maybe entertain one last quick question if you get it in the chat in the next 30 seconds. Otherwise, I'll just pause for a second. We'll say thank you to Dr. Paceley for a wonderful presentation and a great discussion. Thank you for those of you who asked questions. To kind of start thinking about the things that we can be doing, tangible things that we can be doing in our communities to support trans and gender diverse young people. Thank you all for attending, and we hope to see you at our next webinar.
Yes, thank you all, and thank you for being here to support trans and gender diverse young people.